Hello, good evening, good day, good morning, good afternoon, wherever you are in the world, and welcome to the Black Belt Academy of Surgical Skills. My name is David Regan. I'm a cardiac surgeon in Yorkshire in the United Kingdom. I'm the director of the Faculty of Surgical Trainers for the Royal College of Surgeons of Edinburgh, and I'm a visiting professor at Imperial College London. If this is your first time to the Black Belt Academy of Surgical Skills, I'm very grateful and I hope it means something to you and makes sense. I'd also like to thank the 3,068 global followers, and I do appreciate the photographs and pictures and stories that you send. Please keep them coming in as I'm uploading them to the site under followers on what people say and what people do. Last week I had my son assisting me in my theatre at home and has pointed out at the end of the video, he said that he had been standing on a needle. Now this needle was flat on the wooden floor and had not punctured his foot, and on further searching we found 3 needles on the floor. And as my son pointed out, this is my theatre where I am teaching you skills, and it's my responsibility to keep it safe. So I hope you appreciate the 2 Facebook posts following this, where my son reminded me of the human factors involved in keeping a safe environment, and I've now got a lunchbox with my needles on black foam where I can count them in and count them out. I'd like to continue my story with the Book of 5 Rings and Miyamoto Musashi, who's that indomitable samurai warrior of 1643, because I like some of the philosophies that are in martial arts. So here's another passage. In the practice of every way of life and every kind of work, there's a state of mind called that of deviant. Even if you strive diligently on your chosen path day after day, if your heart is not in accord with it, then even if you think you're on a good path from the point of view of straight and true, this is not a genuine path. If you do not pursue a genuine path to its consummation, then a little bit of crookedness in the mind will later turn into a major warp. Reflect on this. It's no wonder that the world should consider martial arts to consist solely of swordsmanship and fighting. It is not. I say to you in the same way, surgery is not cutting and just incising, and there's a lot more to it than meets the eye. This is the balloon I ligated for the advert for this evening's session. There you go, and it's holding. It reminds me of 2 stories. One when I was in SHO doing an appendicectomy, and the artery, the appendicular artery, which is a branch of the postcecal artery, which is the terminal branch of the superior mesenteric artery, which is a direct branch off the aorta, is only about 1 millimeter in diameter. Yet my ligation of this artery was not adequate, and it bled and bled. What is worse, these vessels are muscular, and it retracted back into mesentery, and it was very difficult to find it. And I must have lost 300 mils of blood just from this little spurting 1 millimeter vessel. In a like manner, in cardiac surgery, we harvest the long saphenous vein from the leg. And you can imagine there are lots of small branches. And it always strikes me as crazy that we devolve this to the most junior person in theatre, and we assume they can tie knots. For on the second day of my cardiac experience as a registrar, I walked into intensive care, which was a recovery area in Oxford that Steve Westerby was using as a fast track, and looked at this patient and asked the nurse, there's no blood pressure. And in the moment of me walking there and asking the question, the patient had actually bled out into the chest drains. And without hesitation, I piled into the chest, opened it, and found there was a small 2 millimeter blood vessel branch of the long saphenous vein that had come off. And if you think about it, those 2 millimeter vessels are branches of the long saphenous vein which we stitch directly onto the aorta. And therefore it's vitally important that we are able to tie a knot and it's secure, no matter how small. And anything more than 1 millimeter in diameter needs to be ligated. If it's less, if it's an artery, you may diatherm it. But all veins, because they're thin-walled, are best ligated as well. So, ligation is probably one of the most important things that you're going to do as a surgeon. And I want to take you through some principles and some models that you can use at home to practice these skills. And the sooner you start learning it, the better. So I'll take you over to the overhead cam. I'm grateful to my father-in-law for his help in moving this insofar as that now it's not going to wobble. So over the top here I have simple things. I use dental floss, cotton, fishing line or string, simple bit of cord or a shoelace. And the first thing we're going to do is simply take balloons, and I'll use a bit of cotton, shall I? And we're going to tie this off, and we're going to tie each of these balloons, and then we're going to go through the principles. Now, tying the balloon by yourself with a clip on the end, it moves around and is very difficult to hold. But that's not too dissimilar to what vessels are doing in general. They are moving around and wobbling around. And there you go, it has come undone, and my knot is not buried down. Let's try that again. As my sensei colleague Mr. Caddy said to me, this is where the assistant helps, but it is actually also very useful for practicing your knots, because you do need to be able to tie things down. So I'm going to highlight some principles as I go through, but we'll just take off the clip, and there you go. I'm happy with that tie. Let's try another one, shall we? Let's go for the green balloon, and I'm going to use a bit of fishing line, and I will ask you to spot what I'm doing. So I'm throwing a throw, and I'm actually going to throw a throw the same direction. So I've got 2 half hitches, take it down, and note that I'm actually pausing and my finger is across the knot. I'm now going to complete my knot by throwing a couple more throws. And because this is fishing line, you need to have more throws than a braided suture or piece of string, because otherwise it would slip. And when cutting it, you need to leave a reasonable length so it doesn't come undone. So, whoopsie, there you go. It gives you immediate feedback, and that hasn't quite buried down. But that's the point of these exercises, is to get you to practice. The other one I use regularly is dental floss, and my dental floss here, just pull it out. And it's quite a nice suture material to use, and in fact comes in a reel, and many ligatures do come in reels for convenience sake, and you can hold that in your palm. So let's try the pink balloon. And having the balloon moving around the table a lot does make it rather awkward, but these tests and exercises are there to ensure you can do it. There you go. And that's the balloon. So, what are the principles? The first principle is that we need to tie what's called a square knot. And the square knot is, as you recognize, a flat knot. It sits flat on the table. And if I put my fingers inside this knot and I pull it apart, or try and pull it apart, you can see that it self-tightens. And that's what we should be doing with all our knots. As opposed to what's called a cross knot. This is uncrossed, flat reef knot. And this is a crossed granny knot. And you can see it doesn't sit flat on the table. And if I put my fingers in here, it comes undone. And that is a simple explanation as to why your shoelaces come undone, because you're not tying reef knots or square knots all the time. You have tied them as a cross knot like that. So the next important principle is to appreciate that we need to actually bed the knot down. And to bed a knot down is 2 half hitches, as you see here, and it slips down and the knot is bedded down. The other way to bed a knot down is when tying knots for skin suturing, to secure them, or to tie in drains, is to throw one throw, as you see there, a regular throw, and throw it over again, and then tie it down. And inserting for skin sutures and knot tying, you can lock it up and then continue throwing. So those are the 3 principal knots. And let's go through the exercises. You don't need a fancy knot tying station at home. A block of wood, 2 pencils. I've got the "Have a Nice Day" sign up. And you need to have a piece of string or piece of bootlace, and it's useful to use some felted pen to cover one side or the other. And that is going to be the short arm. Now, there are many videos showing you how to tie knots. And I was at the Merseyside Foundation Student Society, and we have a knot tying station, and people are folding it over their hands and wrapping their fingers around. That's all very well and good, and I'm happy with that. But the principle is you need to understand flat knots. So I'm trying to work out a jingle to put this together to make it easier for you to understand. So I'm holding, and I'll do it with, this applies with both my right and left hand, and you need to understand how to construct knots with both your right and left hand. So I'm holding the short end between my thumb and middle finger. I am supinating my hand and using my index finger to hold the thread out. I'm bringing the thread up into form of a figure of 4. And my index finger now has to flip around the upright and flick that short end through the loop, and I bring it towards me. And you can see that sitting down. You'll now note that I'm holding the short end between my thumb and my index finger. So I'm supinating again. I make another figure of 4, but this time my middle finger is coming through around the upright to bring the short end through, and I'm taking my hand away. And you can see there that is a flat knot. And I can repeat the process. a figure of 4, index finger, bring it towards me. Figure of 4 again, and I'm holding it between thumb and index finger using my middle finger for the throw, and I'm taking it away from me. And that way you see my hands are moving to and fro like a loom, constructing flat knots all the time that don't come undone. The same principle of tying this knot applies using your left hand. And as I say, I'm trying to think of a good, can't get it out of your head ditty. So I'm holding between my thumb and my middle finger, supinating, creating a figure 4 with my index finger out. There you go. There's the figure of 4. Index finger coming around the upright, flicking it through, and I'm taking it towards me again. Note that I'm holding it now between my thumb and my index finger. I'm supinating. I'm now going to use my middle finger to get that short end through that 4, and I'm taking it away from me. And I'm set up again. There you go. And take it towards me. And that is very important in constructing your knots, is to understand that toing and froing of your hands. And the way I'm remembering it, I'm doing a middle finger throw, and it's coming towards me. I'm doing that's index finger throw coming towards me, and a middle finger throw going away from me. So what you might have noticed is tying those knots. One, they need to be cross, but the important thing is your finger needs to go beyond the knot, and you're not pulling across the knot. So first throw and the second throw are the same direction, and we're using that as a slip knot. And why I advocate using a coat hanger on a tabletop is I need to ensure that I do not lift the coat hanger off the table, that my fingers cross the knot and I'm holding the knot down and bedding it. Once I'm happy that it's tensioned properly, I can now continue to throw my knots and alternating them so they're flat or uncrossed. And there's only one consultant that ever stood opposite me and looked at my knot throwing and said crossed or uncrossed each time I did it. Uncrossed being flat, crossed being a granny knot. And the way to test that if you've got it secure is to see if it moves along the coat hanger. Try this with both your hands, right hand and left hand, and the principle is exactly the same. I'm throwing the first throws, I'm throwing the same direction as 2 half hitches, and I'm not as adept at throwing knots with my left hand as I ought, I'm afraid. But my finger is now holding that knot down and sort of pressing it into the table or across the knot. And it's very important, this skill, particularly if you're tying 6/0s or 7/0s sutures. So there we got the knot down, and we got to test, does it move across the surface? It doesn't. This, what's called elbow knot, 2 throws the same direction, like that, is perfect for tying in drains. And certainly as a surgeon, the worst thing you can have is a drain that drops out. And if you imagine that bit of garden hose as a bit of drain, I'm going to put 1 throw in the same movement, second throw 1, take it down. You can see that literally biting into the plastic as I pull it down. And now I can complete my knot by throwing flat knots either side. And to see if it's biting, you can see it's biting into the plastic. That is not going to be pulled out at all. So this, what I call double throw or Edinburgh knot, it's called, is very good for drains. So the last thing you need to be able to practice and need to be able to do is to tie knots at depth. And in this model, we've got a pencil through a plastic cup, and the cup is with a bit of blue tack on a plate. And the idea is that you do not pull the cup off the plate, but you tie the knots around the pencil, and you can vary the depth. I'll show you a little trick on the next pencil and how to pass suture material at depth. And your fingers on the knot. And I actually say it's very important to keep your finger down. The first two throws are the same direction, to bed it down, and you hold the tension there, as you say, finger on the knot. You can then complete your knot tying and test if it's secure. And by using a pencil, it is then possible to see if that is a secure knot. Does it move across the pencil? And it doesn't. So the next challenge is to go deeper. Let's go for 2 phalanges deep. There you go. 2 phalanges deep, and I need to tie to that. Now, a little secret for passing suture material at depth is to use a Roberts or a Leahy. And you see I've got a Leahy here. And I'm going to hold the Leahy and bowstring the suture between the curve and my hand. And I can actually now pass this down at depth, hold it underneath where I want to go, take the Leahy off, and there you go. It's a lovely, accurate way of passing sutures. All too often, when you're asked to pass a suture, people will pass the suture and literally take a floppy end of string like this and try and pass it down, flopping around, and you can't pick it up, and it makes it very awkward. So here we go, 2 phalanges deep, same again, 2 throws the same direction, and each time I put my finger down, I'm going to say finger on the knot. There you go, finger on the knot. And I'm pushing it down, and I'm not pulling the cup off the plate. And I'll complete the lot now. Another thing I like about using dental floss is that, 1, it's readily available, 2, if you pull too hard, it breaks. So let's see if that is a tight knot and it doesn't move. Of course, we need to be able to get to 3 phalanges deep. And it's the same principle again. And show you this little trick of bowstringing the suture across a Roberts or a Leahy and passing it down into an operative field. There you go. Bowstring it across. I can pass it down, hold it underneath, pick it up, and I'm ready to use it. Okay, so this is, I've led myself with a short one here, and we're going to take this all the way down, and you've got to be deliberate in getting your finger to the bottom. Remember, it's 2 throws, the same direction. My finger's going all the way down, and I'm careful also not to crush the cup. I think I've left myself slightly short of my suture material here, but we can do it. There you go, and down. Remember, inverse hold of the scissors. Don't open them any more than necessary to do the job, and cut. And check, is that secure? Lastly, is sometimes you are presented with a rather large vessel, and simply tying it off could mean that it falls off the end. And the best way to secure a large lumen like that is to transfix it. And to transfix it is to take your suture needle through either side of the vessel itself, instead of using a monofilament here, I'm going to tie it down on the one side, and then I'm going to make sure I come back over the whole thing to secure it. And the reason I'm doing that is to ensure that I do not lose the ligature from the end. So that's what's called transfixing a knot and securing it. So let's take the clip off, and there you go. And that is extremely useful, particularly if you have a large vein, long saphenous vein, etc. I wouldn't recommend just relying on tying the knot down. I'll transfix it so it doesn't slip off. So there you have it, some simple principles. 1, you need to ensure that you are tying square, flat reef knots all the time. To start your knot, make sure that you have 2 half hitches and you bed the knot down. And each throw, your finger is on the knot, and say to yourself, finger on the knot, because that is the weight of the forearm and the duration that you're holding it down. And it also ensures you're not pulling across the knot. It becomes therefore a deliberate action. Too many times I see people practicing knots and throwing knots really fast, and the surgeon said, "Sister, can I have some water on the strings, please?" because it seems to be bragging that they're going very fast. Another occasion, throwing series of knots, and the surgeon saying, "Let's see if your brain can work as fast as my hands." I'm not interested in speed. I'm teaching accuracy and technique. Because if you focus on the accuracy and technique, the rhythm and the flow will then come. And that's what makes a good operation. And that is your purpose. I hope this makes sense. Do send me pictures of your practice at home. And I'm contemplating a novel lesson next week as a chat to my sensei colleague Chris Caddy, and has been asked of one of the followers, is I wonder whether we should address communication as a basic surgical skill. I'm thinking about it, but we've completed this cycle. We're going to go back to the beginning again, as we do in martial arts. Every week in the dojo, we practice and practice until we can't get it wrong. It's only through technique and understanding the technique will you then be able to master the skill of surgery, or master the skill of martial arts. I wish you well. Thank you for joining the Black Belt Academy. Be well.